Good morning, everybody. Nasmosh here. Let's talk about patient rights, right? I think I believe in knowledge is empowerment, and patient rights that every single person should know before they have a hospital stay or even before they even go to a hospital, right? This is because many people don't realize how many rights they actually have as a patient when they're in the hospital, right? You're there for help, but also you're there for the right help, right? Let's go down this patient rights one by one. So first, the right to be informed consent, right? You have the right to understand the procedures before agreeing to them. Don't just sign papers, right? I've met patients who sign the papers, they did a procedure or procedure was done to them, and they get discharged home and they don't understand where all this fruition from, right? Ask questions. You can ask questions as much as you want. The second right, the right to refuse treatment, right? Patient can decline medication interventions. You have the right to do that, right? But also I want you to do that wisely, right? If you're declining because you don't understand what's going on, that's good. Let them explain to you what they're doing to you before you take on treatment. Right number 3, right to ask questions. You deserve to understand your care plan. I encourage every person going to the hospital, going to a doctor, ask questions. You need to understand what's going on with you. You need to understand what's going on with your loved one in order to take care of you or your loved one the best. Number 4, the right to a second opinion. Healthcare decisions should feel more informed and comfortable, right? If you've been told something, you have the right to go to another provider. You have to another specialist, right, to know if they have the same ideation. Knowing your rights will actually help you become an active participant in your own care. You need to be an active participant in your own care, not a passive one, because at that you will help your providers, your caregivers, give you the right help, right? You're the one who knows how you want to be taken care of, right? If you don't speak up, right? If you don't understand what's going on around you, how are you going to be an active participant? You don't want to be a passive one, okay? Always remember, you can ask questions as many times as you can. You have patients who are on their way to the OR and something clicks and they're like, oh, hold on, wait a minute. This was not explained to me. When the patient says, I did not understand, everything stops. The surgeon needs to go back and explain it until the patient understands, because that means they signed a consent without understanding, which technically should not happen, right? So if you want to learn more, follow Nurse Mosh for more gems. Have a lovely day, guys.